Yeah, they found out that they've always suspected this, but there's a nice study that was done that showed that stents, which is an invasive surgery, they put this little tube inside your arteries to expand everything, and block, no better off than drugs, first of all. They're a heck of a lot more expensive than drugs. It's like $50,000 for a bypass surgery and, I don't know, $10,000, $20,000 for a stent. And when you have surgery, when they cut you open, man, you know, they're cutting you open. Your body is freaking out.
Sternum? This is a serious piece of flesh here. Think about the emotions that you have stored in this bone right here.
All of it. All of it. That's exactly right, Jonty. There's all kinds of trauma that gets associated with it. Physically, there's adhesions that form, pain. You don't want surgery if you don't have to, and it's ridiculously expensive anyway. So I'm not a big believer in drugs, but I think if a beta blocker, they're using beta blockers and statin drugs and the typical cardiovascular drugs, I say go nutrition. Triglycerides, and that's the second thing that I was talking about here, omega-3 fatty acids for the management of hypertriglyceridemia. Triglycerides are really the problem when it comes to blood fats and heart disease. Cholesterol gets the bad press. Triglycerides, that's really the problem. Triglycerides are intimately connected to calories.
Well, Ben, can you describe what a triglyceride is? I'm hearing 3 chunks of sugar. That's what my brain says when you say
fat. Yeah, that's right. It's structured so you have 3 glycerides on a fat molecule. Actually, I don't. It's a triglyceride. It would have 3 glyceride molecules attached to a backbone. So it looks like this, like an E. It looks like a letter E. Actually, that's what a triglyceride looks like. But it's a blood fat, and some of these are all fats that are coming off of the triglyceride. It's a way the body transports fats. Just like we said earlier, how elements are transported or they're carried, not transported, but they're carried in minerals. In the body, fats are carried on a backbone. 3 fats are traveling on a water-soluble or relatively water-soluble, not really water-soluble, a little bit more water-soluble backbone. So you have triglycerides. It's not, the whole thing is oily and fatty and varied depending on the length of these fats. But in any case, it's a way the body transports energy. So they're intimately connected to calories. What's not used, the calories that are not used, are immediately turned to triglycerides. So if you have a problem with blood fats, high triglycerides, and it's causing occlusion, it's causing stent problem, lay off the calories. It's a calorie issue. And there's also factors how the body processes calories. So use sugar processing nutrients. Sugar processing nutrients, calorie restriction, ketogenic diet. All of these are great ways to keep your triglycerides down, to keep yourself from getting clogged up and coagulated. Now, another factor is when you have little cuts and nicks, as the blood's traveling, it damages the vessels. The blood is traveling in this vortex, in the vessels, it's spinning around. So it can create little nicks and cuts, and there's repair systems. This is really mind-boggling what's happening at the level of the vessel.
Right.
This is what at the cell level, which is the tiniest of levels, 1/100th the size of the head of a pin, the tiniest of living levels inside the body, fundamental living level. And it is, these cells line the inside of the vessel, like the inside of a garden hose. Get your water through a garden hose. And they're repairing things instantly. But if you're sick or you're nutritionally deficient or you're under duress or you spike cortisol or you're eating a lot of sugar, which damages these things, I mean, lifestyle basically creates damage.
Or if you bump your head or get a bruise, fall off your bike.
No, these are inside your heart, I'm talking. This is inside your body.
Okay, I'm just thinking of like the capillaries at the level of, if a blood cell's colliding with the outside of the...
Well, that's always happened. But inside the blood, inside the heart and the cardiovascular system, what I was getting at is the body will patch these little nicks up with cholesterol and with calcium. It'll form Band-Aids on these vessels. And eventually there's lots of plaques that form. It starts to get sticky. You get the immune system involved. There's inflammatory factors that get involved in there. It becomes a big mess. It becomes like a wound that's being healed.
Yeah.
And that's what these things are. These are like wounds that are being healed. And there's lots of them. If you live the standard American life or you're eating the standard American diet, you're not supplementing, there's lots of these little plaquey kind of areas, and sometimes they break off. They can cause clots. I mean, it's not a good thing.
Yeah.
But the way the medical model handles it is by slowing down the blood. They slow down the pumping action, or they stop the body from making the fats, the cholesterol. To me, it makes much more sense to strengthen the blood vessels, to keep the blood vessels strong. Just supplementing is a great strategy. Vitamin C alone will cause problems. Vitamin C, there's a lot of people who tell you that vitamin C deficiency is the real cause of heart disease. There's a place called the Rath Foundation, R-A-T-H, Matthias Rath. He talks about he has a book, Why Animals Don't Get Heart Attacks. And you can't, he makes some very good points. I don't know if he's right, but he makes some really good points. And that is that vitamin C is critical for the integrity of the collagen that makes up the blood vessels. So, he says vitamin C deficiency, animals don't get heart attacks, and vitamin C deficiency is the real cause of heart disease. And I know, I understand his point. In any case, there's lots of strategies you can use. Now, if you're already clogged up and you decide to change your lifestyle, get chelation therapy. That's something I would be doing. If you want to, just for longevity, chelation therapy. And doctors don't like chelation therapy. A lot of doctors
Just describe chelation therapy for the sake of our audience.
Chelation, a chelating agent, something that chelates, is like a magnet. Just think of iron, like iron and a magnet, right? Chelation is a magnetic attraction. It's a pull. To chelate means to claw in Latin. So when something's chelated, it's clawed. It's attached. It's attached magnetically. So you have chelated amino acids, chelated minerals, and it's one of the ways the body, one of the tricks the biological system uses to make minerals more available is it will chelate them with amino acids. So in the body, there are certain amino acids that have chelating properties, and when you eat a mineral in your pancreas or in your intestine, these chelating agents will grab the mineral and form chelates in the body. And they use them sometimes as nutritional supplements as well. But chelation therapy is when they do it by sticking in a magnet, injecting a magnet into your bloodstream. And then the magnet goes and it sucks up all the toxins and the heavy metals and the calcium deposits and all the stuff, all the gook out of the blood. And eventually, if you do it over time, it helps clean out your blood. And toxemia, or toxic blood, what I call dirty blood, is really what we're talking about here. Our blood becomes dirty.
Yeah.
Over time, we eat a lot of sugar. We eat the standard American lifestyle, live the standard American lifestyle. In addition to having nicks and cuts in the blood vessels and plaques, now you got these elevated blood fats, lots of triglycerides. Triglycerides glom up the system. The body will try to store some of them, but eventually they will glom up the system. And triglycerides can be people can have serious elevated 10, 20 times the amount of triglycerides that should be in the blood, if they have a serious problem. So the way you deal with triglycerides is with nutrition. Number one, the mighty 9 essential nutrients. That's always the basis. But in addition to helping your body process sugar, process energy, chromium, vanadium, selenium, the second study that we were talking about here I think is very interesting. It was very timely when I saw it. Omega-3 fatty acids. That's one of omega-3 fatty acids' claim to fame, is that they can lower blood fats. In fact, omega-3 fatty acids are so important, and I should say so well recognized as blood fat triglyceride lowerers. There's actually a prescription drug now called Vascepa, which is, guess what? It's fish oil, but with a drug version.
Jeez, man.
It's tweaked. They tweaked, put a little bend in it, and they got themselves a drug version. But that's to me, if you read between the lines, what they're saying is fish oil works.
right, exactly. And that's why we want to sell it back to you at 100 times the cost.
They say it's more purified, blah, 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 and they make it right. Yeah. But fish oil also has other factors in it. This is EPA. There's 2 omega-3. And this is, I got to run now, but I want to say this last thing about omega fatty acids. Is there's just like there's a lot of confusion with minerals, there's a lot of confusion with omega fatty acids, like what they are, what an essential fatty acid is. And maybe we should do a talk, our next video we can do on EFA. But let me just say this. Omega-3 fatty acids refers to the shape of the chemistry, the shape of the molecule, specifically where the double bonds are, without getting into too much chemistry. So omega-3s or the designation omega-3 refers to its shape, its structure. Not all omega-3s are essential. we lump those two together. We always say omega's essential. That's kind of a misnomer or misreading or misrepresentation of what omegas are. Omegas are just a shape. There's lots of omega-3s. There's only one essential fatty acid, omega-3, and that's called alpha linolenic acid, and it's found in seeds, like flax seeds, chia seeds, grasses. It's not as well found as alpha linoleic acid, which is the omega-6 essential fatty acid. That one's ubiquitous. That one's found in a lot of places. It's found throughout the body. Omega-3s are a little bit rare, or the essential fatty acids from omega-3s are a bit rarer. The omega-3s, the fish oil omega-3s, are not essential. They're not essential. You can make them out of essential. Essential means you have to have it. You understand what I'm saying? So fish oil omega-3s are non-essential. They're not parent essential fatty acid molecules. They're derivatives, and you can make your own. They're not essential. You can make your own. Essential means you can't make it. So you can make your own, right? Nonetheless, they have powerful biological effects. Now, EFAs are tricky because the body isn't, from an evolutionary standpoint, we didn't evolve getting huge hits of EFAs. They trickled in, and they got broken down. They were found in foods. You have to digest them. You have to break them down. Today, we use EFAs medicinally and therapeutically, and that makes them a little bit tricky because the body isn't really equipped to handle big hits of EFAs, and so the balance becomes important. Sometimes you'll hear people talking about omega-6 to omega-3 balance. Some people, there's different things. Some people say they like omega-6s from fermented foods, or other people will say from eggs or from grains. Some people say stay away from grains. It's really hard to know with the omega fatty acids. I say just dose until your skin looks good. The number one parameter for omega-6 criteria for omega-6 deficiency is skin disease. When they want to test what a vitamin does or what a nutrient does, they'll take an animal and they'll feed him all the nutrients except one, and they'll see what disease he gets. And they'll know what the disease is that's caused by that deficiency, right? So they take C out of the diet, they get scurvy. They take vitamin D out of the diet, they get rickets. They take vitamin B1 out of the diet, and they get beriberi. You know what I'm saying? They take a certain nutrient acid. When they take EFAs out of the diet, omega-6 EFAs, their skin looks like crap. Your skin turns crappy. It turns dry. It turns crepey. It turns awful. It turns itchy. It's all the things we hate about our skin are what happen when they take EFAs out of the diet of an animal. So they have an amazing medicinal and therapeutic effect on skin issues. And because they're hard to find in foods, and because when you process them, you cook them out and all the things we do to foods, and if you're not supplementing, it's pretty easy to become deficient in these things. And I would say a lot of skin diseases could be helped by people supplementing with the ultimate EFAs, with essential fatty acids, eating essential fatty acid rich food, which means not really processing your food a lot, but paying attention to the EFA status of your body, and then also that involves digestion, but we can talk about that on another video.
And heart disease as well.
Heart disease as well, absolutely. Heart disease and the circulatory system. In fact, that's one of the most important places where EFAs really show up is in heart disease and cardiovascular health issues. And of course, that implies kidney health, and that implies liver health, and really the health of the whole body. They're super, super fundamental molecules. They're not in the category of vitamins. They're actually in the category of hormones. They're in the category, they're control points for the production of what I call master hormones. Master hormones are they call them eicosanoids. They're this group of molecules that control all of the inflammation and anti-inflammation processes in the body. And inflammation and anti-inflammation are always occurring. And so EFAs get turned into these master molecules, and these master molecules control the inflammatory system of the body, which is everything. So anywhere they're and anti-inflammatory drugs all work at this level. EFAs, eicosanoids, master hormones, and then the molecules of inflammation. So EFAs are like natural aspirin. They're like natural anti-inflammatories. EFAs are natural statin drugs. EFAs are natural estrogens. EFAs are, like I said, they're tricky because the body wasn't designed to get big hits of EFAs. So you got to be a little bit, got to kind of pay attention to your EFAs. That's why supplements like the Ultimate EFAs are nice. They're pre-balanced for you.
Right.
You just take capsules. You got to kind of know what you're doing if you're not using a good EFA supplement. But they are super powerful medicinal substances, particularly if you're dealing with inflammation, with an inflammatory problem.
And who isn't? I mean, who doesn't have a hurt back or
I'm not talking about that kind of inflammation. That's a really good thing you just said. If we think of inflammation, we think of that.
Yeah.
We think of and we think of arthritis. I'm talking micro-inflammation.
Right.
The kind of inflammation you don't know you have until you get a disease. You always hear about people saying how inflammation is all disease. And because we think of inflammation as being, a broken arm or sore back,
right.
that's macro inflammation. But the same version of macro inflammation, or the cell has its version of macro inflammation called micro inflammation. And it's the same thing. You get the fluid and you get the walled off material and, all the classic signs of an inflammatory process in your knee. When you tweak your knee, you get it at the cell level. And this micro-inflammatory process, we don't think of it that we don't really, it's hard to compute because it's happening at such a small level. We don't notice it. But what happens is this happens over the course of a lifetime, these micro-inflammatory pockets. And you get these micro-inflammatory, just like arthritis. You get macro-inflammatory inflammatory pockets in your joints. You get micro-inflammatory pockets at the cell level. And when it happens a lot in the liver, if you're abusing your liver, you get liver disease. If it happens in the kidneys, you get kidney disease. If it happens in the heart or the blood vessels, you get cardiovascular disease. So anywhere where you can control micro-inflammation, or anything you could do to control micro-inflammation, is going to have a positive health effect. And that's where EFAs really shine. And your point's well taken. They'll help with back pain too. At the microscopic or micro-inflammatory level, they'll add years to your life.
Right.
They'll reduce the risk of heart disease or the symptoms of heart disease.
Right.
Disease or anything else.